A British Columbia doctor's revelation that people are having their toes, feet and legs amputated due to a government policy has the BC Liberals in damage control. One day after an A News investigation uncovered the policy change, the Health Ministry says it is reviewing the policy. Last year, the government decided it would no longer pay for orthopedic shoes and inserts except when there is a risk of amputation. A News reporter Stephen Andrew has more.
This 24-year-old woman lives with a severe mental and physical disability.
One foot is a different size than the other foot because it curls so much.
Her mother says she needs orthotics, shoe inserts that help her to walk. But after years of supplying the orthopedic devices, the BC government stopped paying, except if the patient was at risk of having their feet amputated.
So if they would have ticked yes, we would have been covered.
Since we first broke the story yesterday, Melissa's mother has heard from many other patients, all fighting the same battle.
A lot of the mums and dads that I know are burnt out and frustrated and are waving the white flag and saying, you know what, we're almost giving up because we don't know where to turn anymore.
Now, a Vancouver doctor is coming forward saying the policy is actually responsible for her patients having their toes, feet and legs amputated.
It makes me sick. It's horrible. Not just the amputations, but the ones in pain and the children particularly.
The Vancouver podiatrist joined MLAs Jenny Kwan and Mike Farnworth as the NDP called for the government to reverse its policy.
It costs the healthcare system more. An amputation is around $10,000. A major intervention on the foot is around $10,000.
The NDP says the cuts for Melissa and other people living with disabilities are harmful to their future health. When A News began asking questions about the policy, Melissa's mother received a call from the director of the Health Assistance Branch.
And he said, "You don't know me, I'm the director." And I said, "Yes, sir, I do know you. I've tried calling you several times, but I hit a roadblock at your front end staff. They won't put me through. So we will talk on Monday."
That may be the first conversation the government is having on the issue. Dr. Grayson says podiatrists were never consulted on the issue, a policy change that is making it very difficult to treat patients.
To have to actually look at somebody in the eye and say, I know it hurts. I could prevent it, but we don't have the funding. Sometimes I do it out of pocket myself because I can't stand it. It's too hard to look at.
Come your foot, honey.
Colleen Matthews promises she's not prepared to let that go on any longer.
As corny as it sounds, it's not just Melissa I'm fighting for. I will get orthotics for Melissa one way or another. If I buy them, I buy them. It's not a big deal with me, but I want that regulation rescinded or whatever they do in the government to take it out and put it back the way it was.
Stephen Andrew joins us with more on the story. Stephen, it appears the government is in damage control tonight.
It does, Eric. After trying to reach them all day to get a response on this, Mike DeYoung, the Minister of Health, contacted the station just before we went to air and says he's prepared to look into this issue to ensure that low-income adults are able to access orthotics when medically necessary. He said he's concerned that the change in policy within the Ministry of Social Development could be placing more costs, actually, on his ministry, the Health Ministry. Now, we know there are other people out there with similar stories, and we'd love to hear them. Here's how you can get in touch. You can email islandnews@atv.ca, or you can call 250-414-6510, or toll free at 1-866-242-2484. And if you would like to reach me directly on Twitter, you can do that. Just log on and search for me with the name @ANewsStephen. Eric?
Stephen Andrew reporting tonight. Thank you, Stephen.
You're welcome.